In 2012, LHSC launched this exciting initiative, and it's a 3-month intensive training program, and we're trying to draw in candidates from around the world to come and participate in this program and learn from our donor coordinators and our recipient coordinators about organ donation and transplantation.
It's a great opportunity, I think, knowing the history of our program and how many over 5,000 organ transplants that we've done here, that the expertise is here and they can come and get trained.
Actually, we were approached by Faisal, a candidate from Saudi Arabia. He approached us. We're an internationally renowned program. He knew about our uniqueness and what we had to offer.
And I was looking for the center that has the 2 roles, like a donor coordinator and a recipient coordinator. And I found the London Health Science Center and Multi-Organ Transplant here, they're having the both role.
And we really built the program from that initial request.
And then taking that forward and developing an educational program and a tool that we can use not only for Faisal but for other purposes as well.
The goal of the program is to disseminate best practices. Again, we are leaders on the world stage and we do things differently. We have different structures, different processes, different activities that we want to share. Faisal's goals and his hospital's goals was to really change some of the roles and separate some of the roles around organ donation and recipient coordination.
We spent a lot of time with him in sort of a classroom setting, letting him know about some of the theoretical practices that is required for the job.
He came to this experience, and it hasn't been just a shadowing experience, but it's actually been hands-on, and that's the way we built it because we thought that would optimize his learning to ensure it's fully experiential.
We have a large team. We have lots of allied health.
He's been immersed in clinical care. He's really participated in the entire continuum of care. From a recipient perspective, he's been involved in pre-assessment, the process of patients being listed.
Get the chance a few times to went with the donor transplant coordinator to go and retrieve an organ from different city in here around in the Ontario, and also involved in the OR where they're doing the recipient. And also provide education to patient post-operative. I think this program, I believe it's a good curve of learning, and especially here they are busy and they're doing a lot of cases, like almost every week they're doing 1 to 2 cases, transplant case.
Well, I think there are tremendous benefits for LHSC. First of all, it's been tremendously team building for our group. It's really brought us together to drive forward with this exciting initiative.
I think it's a great opportunity for him to come to this part of the world and see what we're doing, and hopefully it will give him some ideas to improve what they're doing in Saudi Arabia.
You know, I get a chance to work also and with the social worker and the dietitian and the pharmacist and in the unit also. So all of them were helping, and you know, they're encouraging, and you know, so this is really a good place to come and learn.
It allows us to showcase ourselves on an international stage. We tend to be very humble here at LHSC, and we really ought not to be. We really need to be disseminating our processes and practices at an international level.
Well, if someone coming to considering training in the London Health Science, so I will encourage them to come here, and I will say this is a great place to learn, and you will learn a lot. This is a busy place.
And we are actively trying to recruit people internationally, not just at a provincial, national level, but really looking for future participants from that international pool.